My name is Dr. Soni Dodani. I am the founding director of EVMS-Sentara Healthcare Analytics and Delivery Science Institute, commonly known as HADSI. HADSI came into inception in 2017. The major goal of HADSI was to improve the health disparities within the region through the use of healthcare analytics and delivery science tools. This is a very neat concept where EVMS and Sentara came together to work collaboratively in partnership with each other and make the best use of healthcare data from Sentara and provide evidence on reducing health disparities in the region.
Our goal is to just provide more insight into data. It's easy to collect data, but our goal is to parse that out, to provide insight as to what it's saying and how we can use that information to improve the quality of life of people and patients.
Addressing health disparities in the region is a generational amount of work. It is not something that could be achieved within a short period of time and requires substantial resources. Bringing parties together under one umbrella to share information and to share strategies can have significant impact on enhancing collaboration, research, and activities towards reducing health disparities in the Commonwealth.
The only way where we can reduce these disparities is by coming together. That is where I started this forum.
You have institutions that are academic, you have your healthcare institutions, and those are the organizations that really have reach, resources, and respect. So when you have those large organizations and you couple it with smaller community organizations, we are able to really benefit. What we bring is the community perspective.
Every area of Virginia has its own unique opportunities and challenges. Speaking for Northern Virginia, our region is actually not all that big by comparison to the whole state. Our issues aren't so much geographical, but we do have very diverse communities, but also potentially very isolated communities.
So I work with Virginia Cooperative Extension in developing, promoting, disseminating health-related programs through cooperative extension educators. A lot of my work is in rural communities, so we're doing some work around the opioid issue and the opioids that's really impacting rural communities. Also just chronic disease management and care, both at the prevention end, but also at the management end.
Children's mental health doesn't just depend on healthcare equity. Children's mental health depends on equity across all of our systems. Equity in education, equity in food distribution. We need to have equity in transportation access. The goal is to engage all of those sectors.
Health disparities is not just for the other. It is incumbent upon all of us to care about this. So when you get questions or get requests to volunteer, to be able to donate, or just get pieces of information and you're asked to share, please do. You literally can be saving a life.
What is most important is the power of togetherness. What we can get achieved by joining hands, we cannot achieve it alone.